No one wants to get old. What if there was a way to stay young? When we are young, we all think we are invincible and that we will never get old. When we are older, we want to look younger and relive our youthful days. Plastic surgery and cosmetic enhancements are on the rise because of this. Well, what if I told you there is a supplement that might be the fountain of youth? Today's video is about a supplement called DHEA, dehydroepiandrosterone. For the sake of this video and the ball ache of pronouncing it, I'll just call it DHEA. It's been around for years and it occasionally pops up on social media, and recently Joe Rogan mentioned it on his podcast. I'll be talking about the supplement, my opinions on it, a bit about the research and what the evidence says, and if you want to try it, what the dose the evidence recommends. Let's jump into it. With all supplementation, before taking, you should always speak to your doctor or physician, especially if you have any underlying medical conditions. So what is DHEA? DHEA is a hormone that your body produces naturally in the adrenal glands. DHEA is a precursor, which means it helps produce other hormones like testosterone and estrogen. As we age, DHEA levels in the body peak between 20 and 30 and slowly decline going forward. By the time we hit 60 years of age, it's thought that DHEA levels can drop as low as 20% of their peak value. So in theory, if you supplemented with DHEA to bring your levels back up to peak, you would reap the benefits of your younger self. Well, sadly no. So far, research hasn't proved this to be true. More studies are needed to better understand whether DHEA supplementation can counteract some of the effects of aging. A small study suggested that taking DHEA supplements might improve skin hydration and firmness, and possibly decrease aging spots in elderly adults. The possible benefits. So possible benefits of DHEA is it may alleviate the symptoms of aging because of the possible effects it has on body systems, which I will explain now. So DHEA may increase IGF-1, which is insulin-like growth factor 1. This stimulates growth in cells, and a little later on I'll be talking about growth and aging. An increase in bone mineral density. Now, most evidence suggests no increase in bone mineral density, but this may be due to short trials, so 6 months or less most of the trials have been. Longer trials note a small but unreliable increase in bone mineral density. So there may be a role of DHEA in bone mineral health, but it's currently uncertain. Now, it may help elderly people have a better functionality, so it may help them move a little better. That may help their mental health to some extent as well. Now, DHEA may increase DHT levels alongside testosterone levels, but this has only been observed in post-menopausal women and not in men. If this is the case for men, then it may lead to possible balding. But again, DHT isn't the only cause of balding, so even that's hit and miss. There is some evidence to say DHEA can help with fertility. Some evidence points to an increase in free testosterone. So that is testosterone that circulates around the body. This may have an effect on aging. Again, later on I'll be talking about testosterone and aging. DHEA might be more effective at treating depression than a placebo, especially in people with low DHE levels, which may contribute to their depression. Vaginal atrophy. This is where the lining of the vagina gets thinner, leading to dryness and irritation. Limited research suggests that DHEA might improve vaginal dryness in postmenopausal women, as it slightly increases estrogen, and vaginal atrophy is caused by a reduction in estrogen levels. A lot of people talk about DHEA can help with fat loss and to increase muscle mass. Again, it's a precursor of testosterone, so maybe. But all the studies looking at this have said it's not effective. Higher doses might be required to gain the benefits, but again, this is unclear and comes with a lot of side effects and problems. So side effects of DHEA. With everything, the more you take and the longer you take it, the more chance of side effects. It has been noted that a dose of 50 milligram per day has been safely used for 1 year, and a dose of 25 milligram per day has safely been used for 2 years. Women, though, should take a much smaller dose, around 5 to 10 milligrams per day. Anything longer than 2 years hasn't really been studied, so it's hard to say whether it's going to have any effect or whether it's going to have any side effects. Now, the possible side effects are oily or greasy skin, an increase in acne, increased hair growth in men and women on the face and armpits. There may also be a cancer risk when taking DHEA, especially if you're at the higher risk of hormone-based cancers like prostate or breast cancer. If you are, then stay away from it no matter what. My thoughts on DHEA. With everything, you have to weigh up the risk versus the benefit. Do I believe the benefit is worth the risk? No, not at all. The evidence is too unclear, and the side effects are almost as risky as testosterone replacement therapy. At least with TRT, there is almost a guaranteed benefit. Now, I said I would talk about growth and testosterone in relation to aging. It has been said that human growth hormone can greatly help with aging. And a lot of celebs use it, but pharmacy grade growth comes with a hefty price tag. In regards to testosterone, as we age, test levels deplete, as we have talked about with this video, but there are ways to increase your testosterone naturally, which in turn may reduce the effects of aging. So if you have poor sleep, you are overweight, you have a shit diet, which is low in nutritious foods, you are over 20% body fat as a male or over 30% body fat as a female, you are as active as a sloth, then focus on improving all those aspects and you will feel better, you will look better, and you will increase your testosterone levels naturally. That concludes today's video. I hope you found it useful. If you have, then make sure to give it a like. If you haven't already, then hit that subscribe button and ring that bell so we can become best friends. I hope to see you all for the next video. Until next time, farewell.